Hair loss is a common side effect of chemotherapy, and we understand for many this can be a distressing experience. This video is to show you what to expect if you have scalp cooling during chemotherapy. Scalp cooling has been proven to minimise hair loss in patients receiving certain types of chemotherapy. Scalp cooling works in two ways. It reduces the metabolism of the follicle cell and also constricts the blood vessels in the scalp. This prevents the chemotherapy from reaching the hair follicles and hopefully reducing hair loss. It is important to understand that the amount of hair loss will vary from person to person. The success of the scalp cooling depends on many factors, such as the type of chemotherapy, hair type, hair condition, and ethnicity. It is normal to experience some hair thinning. For some, the cap is less effective and they do develop bald patches, especially on the crown of their head. It is advisable to wear warm clothes even in warmer weather. Layers are usually a good idea. There are a number of items you'll be asked to bring with you for each treatment. These are a hair conditioner and a fabric headband. Before we apply the cold cap, you'll be asked to dampen down your hair. Then you can apply enough conditioner so there is just enough to coat your hair when it is combed through. This will stop your hair from drying out and from sticking to the cap when it is removed. The headband is positioned just under your hairline and over your ears to prevent these areas from feeling cold. You will be offered a mild sedative. This may make you feel drowsy, and it's important not to drive afterwards. The cap needs to be applied 30 minutes before you start your treatment. It comes in 3 different sizes: small, medium, and large. It is important to feel contact everywhere on your scalp, particularly the crown of your head. A fabric cap is placed over the top of the cool cap. This is designed to anchor the cool cap into position and will feel quite tight due to the chin strap. It will then stay on for the duration of your treatment and for up to 1.5 hours afterwards. This will depend on your chemotherapy regime. The scalp cooler has dual tubing, so you are likely to be sharing the machine with somebody else. Your tubing is programmed specifically for you, even though you are sharing a machine. When the machine is turned on, the cap will cool down very quickly. You may feel quite cold for the duration of your treatment, and we will provide you with warm blankets. The cold sensation will feel very intense for the first 15 minutes, and normally is more manageable after this. During your treatment, you are still able to eat and drink as normal. The tubes from the cooling machine can be disconnected when you need to go to the toilet. It is important to note that if you need to disconnect your tubes, there will be no interference whatsoever to the other tubes or patient connected to the same machine. The cap will remain cool when disconnected for 10 minutes. To help protect your hair when having chemotherapy, avoid excessive heat from hairdryers, tongs, and straighteners. Avoid using chemicals such as perms and colours. Avoid excessive washing and use a mild shampoo. And remember, your hair will grow back on the completion of your treatment. I hope you found this information useful, and thank you for watching.